Hello, everyone, and welcome to another episode of BrightLearn. Today, we're tackling a topic that affects every single one of us: the U.S. healthcare system. But here's the twist: we're going to explore it through the lens of a fascinating book titled Oxymorons: The Myth of a U.S. Healthcare System by J.D. Kleinke. Now, when we think of a system, we often imagine something organized, efficient, and maybe even a little bit predictable. But as Kleinke reveals, the U.S. healthcare system is anything but. In fact, it's more like a chaotic, fragmented landscape shaped by historical accidents, conflicting interests, and a dizzying array of economic schemes. Picture this. It's 1943, the height of World War II, and a shipyard laborer has a heart attack. His family begs the boss for extra pay to cover medical bills, but thanks to a wartime pay freeze, that's a no-go. So, what does the boss do? He decides to pay the hospital directly and even brings doctors into the shipyard. This, my friends, is the origin story of employer-based health insurance, a system born out of necessity and improvisation, not careful planning. Fast forward to today, and this makeshift solution has become the backbone of our healthcare system. But, as Kleinke points out, it's a system that's deeply flawed. For starters, it's built on a foundation of tax incentives that encourage employers to provide health insurance, but only if they do so through the workplace. This creates a bizarre situation where the same medical coverage costs an employer 75 cents, but would cost the employee a full dollar in pretax income. It's a system that favors those with good jobs and leaves millions of Americans in the lurch. And let's not forget the role of managed care organizations, or MCOs. These entities were supposed to be the solution to rising healthcare costs, but as Kleinke argues, they've become part of the problem. MCOs add layers of complexity and bureaucracy, often prioritizing cost-cutting over patient care. They create a system where doctors are incentivized to spend less time with patients and where medical decisions are driven by financial considerations rather than clinical needs. Kleinke uses the term managed care as a metaphor for the broader dysfunction in the system. It's a system where the pursuit of efficiency has led to over-organization, where the quest for cost savings has resulted in a maze of paperwork and red tape. It's a system that leaves patients, doctors, and even employers feeling frustrated and powerless. But here's where things get really interesting. Kleinke doesn't just critique the system, he offers a way forward. He proposes a radical shift towards a more consumer-driven healthcare market. Imagine a world where you, the patient, have more control over your healthcare dollars, where you can choose your own health plan, compare prices, and make informed decisions about your care. One of the key proposals Kleinke puts forth is the idea of legalizing catastrophic-only insurance policies in a standalone risk pool. This would allow insurers to offer plans with lower premiums and higher deductibles, giving consumers the flexibility to choose a plan that fits their needs and budget. It would also create a more competitive marketplace, driving down costs and improving outcomes. Now I know what you're thinking. This sounds great, but how do we get there? Well, Kleinke suggests that we need to rethink the role of employers in the healthcare system. Instead of providing health insurance directly, employers could give employees pre-tax dollars to spend on their own health coverage. This would empower employees to choose the plan that works best for them, whether it's a traditional plan, a catastrophic-only policy, or something in between. Kleinke also advocates for a standardized national benefit plan. This would simplify the system, reduce administrative costs, and make it easier for consumers to compare plans. It would also help address the issue of risk pooling, ensuring that everyone has access to affordable coverage. But here's the catch. Implementing these changes won't be easy. Kleinke acknowledges that there are powerful interests vested in the status quo. Health insurance brokers, for example, have a lot to lose if the system becomes more transparent and efficient. And let's not forget the political challenges. Any attempt to reform the healthcare system is bound to face fierce opposition from those who benefit from the current mess. Despite these challenges, Kleinke remains optimistic. He believes that by embracing the principles of complexity and chaos theory, we can create a healthcare system that is more resilient, more adaptable, and more responsive to the needs of patients. He envisions a system where medical decisions are driven by science and compassion, not by bureaucratic imperatives or financial constraints. So, what can we, as consumers, do to push for change? Kleinke urges us to be informed, to ask questions, and to demand transparency. He encourages us to support policies that promote consumer choice, continuity of care, and affordability. And most importantly, he reminds us that change is possible, but it requires all of us to get involved and make our voices heard. That's all for today's episode of BrightLearn. I hope this conversation has given you some food for thought and maybe even inspired you to take action. If you enjoyed this episode, be sure to subscribe and leave us a review. And don't forget to check out J.D. Kleinke's book, Oxymorons, The Myth of a U.S. Healthcare System, for a deeper dive into these issues. Until next time, keep learning, keep questioning, and keep pushing for a better world.
Visit brightlearn.ai for more fascinating videos like this one, and naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.